When it comes to trauma in a child, I think there's a couple things we really have to understand. So first of all, the word trauma, I feel like has a social connotation for violence. There's one thing we really have to remember is that trauma can come in the form of emotional, it can be verbally abusive trauma, it could even be the opposite, be neglect. And so in addition to understanding the signs of trauma, we have to understand that trauma comes in all shapes and sizes.
The experience of trauma is different for each teen, and so what I might consider trauma is not trauma to somebody else, and vice versa. So some traumatic experiences that we've run into in our schools, so physical and sexual abuse, bullying, car accidents, parents or good friends dying, breakup in relationships, and then sexual orientation issues. And so being bullied around sexual orientation or issues of coming out regarding sexual orientation and then that not being understood or heard, right, or validated. Matter of fact, it can be sometimes invalidated.
But any type of trauma can really mess with the child's stress response. The HPA axis is basically a way our body governs a stress response. So it could either be seeing a scary flu shot needle, or it could be running away from a bear. In children that have experienced trauma that actually get a form of PTSD, they have a hyper-responsive stress response, and it's all because of that HPA axis.
There's this substance cortisol that your body produces when you're in a anxiety-producing situation that actually blocks other mental processes. Cortisol interferes with your ability to have finely nuanced understanding and shades of meaning. It's much more black and white. It's much more, this is safe or this isn't safe. It's a more reactive state.
Having a event that occurs that cuts to the core of that person of who they are and not being accepted or not being able to deal with that intensity of the emotion becomes a traumatic type of experience. And so it overwhelms the cognitive functioning to where it's all emotional dysregulation, right? The emotions are all making these decisions.
So they'll do things in the urgent care, in clinic, such as they'll cry excessively. They'll be completely withdrawn. They won't make eye contact with me. They'll act completely temperamental. Older children can be abusive, can be verbally abusive, can throw things. And this is all in addition to clear physical signs that I think we as physicians are a little bit more used to looking for. It's a lot easier to look at a bruise, for example, and say, does it actually make sense? Does the story make sense of how you got that bruise? If you got a fracture on your leg, do I actually believe the story that's being told? And these are things that every one of us, by our instinct as scientists, look for. But as I just mentioned, there's a complete subtext in behavior that we really have to get on our radar. And again, you really take a step back and you say, is this how I expect a child to behave? Is there something that the child is trying to tell me by these actions that I'm simply not grasping?
Aggression is really one of the most common ways that children express that trauma when they're, young, like preschool age. School age kids have a different way of expressing that. They become very anxious. So a lot of times they can't really make the transition between recess and going back to class, or things in the school day become just too much for them.
Trauma experience on the mental health side is that they get their emotional system gets kind of overloaded. They don't know how to deal with it. They have these strong, quick surges of emotion that cause them some what we call emotional pain, and we don't have really good coping strategies to help our adolescents with those things.